Thank you, Sue. I'm delighted to be here again. Thank you so much for inviting me. I love coming on Midwifery Hour and very excited to share our learning. So if you could please share my slides for me, and I will begin. So tonight I'm going to talk all about nurturing midwifery students in a positive clinical learning environment, because this is what we are there to do. It's the essence of what we do as midwifery educators. So I thought it was a really nice topic for tonight's programme, and I hope you'll enjoy our story at Fatima College. The first thing I'm going to do tonight is give you an update, because I know if you've been following our story on Midwifery Hour, you'll be familiar with us. For those of you who don't know about us, we are a team who started the first Bachelor's of Midwifery Direct Entry degree programme at Fatima College of Health Sciences, which is a healthcare sciences college in Abu Dhabi in the United Arab Emirates. And we started our journey back in 2021. And we're really growing. We're coming a long way. We're very proud of the work that we've done. We were fully accredited just last year, and we currently have 2 batches of midwives going through. So we have 7 midwifery students in 3rd year. We have 5 midwifery students in 2nd year, and we actually have 9 midwifery students in 1st year. And the incoming, I'm proud to announce that there's actually 17 midwifery students registered to start in August. So this is really, really exciting time to be part of this really brilliant initiative. It's really fantastic that the UAE has recognised the potential of midwifery and the power of midwifery, I guess, in strengthening outcomes for women's health and for newborns as well. It's part of the national strategy, and our college is actually under the patronage of Sheikha Fatima bint Mubarak, the Mother of the Nation, who is the author of the national strategy for early childhood and motherhood as well. So it's a really, really fantastic initiative, and it's fantastic to have the support behind us. So hopefully on the screen you can see a lovely picture of our education team. From left to right you can see myself, Joanna Andrews, Caradine Aird and Dr Georgina Sosa. You're probably all familiar with Gina because we started out together on this journey back in 2021, but we're absolutely delighted to have Caradine join us as senior instructor in October last year, and Joanna has travelled from the UK in January this year. So we're undergoing massive change all very rapidly, and it's, like I said, it's exciting, but we're learning as we go. And definitely it's important to share the learning as we go as well, because if you're in a country where you haven't got midwifery degree programme up and running, hopefully some of the tips that I'll share tonight will help you to start your midwifery programme and for it to be successful as well. Tonight I'm going to talk about the importance of clinical placement opportunities for midwifery students. Why do we have a clinical placement? To think about and consider what makes a competent midwife. How do we know when someone has reached competence? To explore what a positive clinical learning environment looks like. And I also want to help countries that don't have many midwives to prepare for an adequate placement site, because it is a challenge. And finally, I'm going to help you to understand what an enabling environment means and how learning objectives can be met for midwifery students when there's not many midwives, because that's a challenge that we've faced. Actually, more than 50% of midwifery training makes up our midwifery degree programme. It's a large part of what we do. And we're running our midwifery programme in the UAE as a block system. So similar to the UK, where we do 8 weeks or 12 weeks in theory, and then we move on to the clinical placement. But we're actually front loading with a lot of simulation in the lab. So we're running our fundamentals of midwifery and our clinical health assessment for midwifery procedures, that kind of thing, in tandems. We do a theoretical component, which is linked up with the lab, which works out really nicely for the girls so that they have a sense of the skills that they need and the theory before they go out into clinical placement. So our second years have just come to the end of all their theoretical knowledge, and we're just preparing them to go into the clinical area. They'll have their first clinical placement for 4 weeks in June, the end of May, start of June. And this is a really important time. So it's actually a really timely presentation for us as well, because we're just about to start this placement for those students. Our third years are currently come to the end of their complex women and newborn clinical placement. I'm out there at the moment with them. And it's just really exciting actually to see their progress and to see them flourish. So let's think about what makes a good midwife. So I just did a quick brainstorm, and probably if you brainstormed, you'd come up with some of these terms. I'm sure the most important thing that we want is a safe midwife. We want a midwife at the end of the day who's prepared and ready for licensure, who's competent. So that's probably the top characteristic that we would think of if we were thinking about what makes a good midwife. But as midwives, we know that there's far more to this than just being competent. The clinical skills, the knowledge, really, really important. We have definitely got to hone those skills. But there's professional behaviours as well. There's things like being punctual, our attitude, our ability to be reliable, actually being professional in all our behaviours. There's our ability to be critical thinkers, to use evidence to support our practices. And then as midwives, we all will pick a role model. When you start your clinical placement as a student midwife, I'm sure you will work alongside someone, you'll go, her, I want to be like her. What is it about that midwife? I want you, if you're a student midwife, to think now, you've probably got someone in your mind. Who is it? And what is it about her that she does that you want to be like her? And maybe it's that she does less rather than more, because a lot of what we do to deliver woman-centered care is actually being with the woman, listening to the woman, and this notion of watchful attendance, sitting on your hands, sitting knitting. So we have this whole other set of skills which we can't actually define or maybe verbalize, but it's actually gained by experience. So only through clinical experience can you actually be a good midwife. So the clinical placement that we offer is really, really important. So looking at the evidence, we know that clinical placement is a really important exercise. It gives our students the opportunity to increase their knowledge, skills, attitudes, and their interest in the profession before they actually go into the clinical area. Maybe they have an idea in their mind of what is a midwife, but until they actually go out and practice, they can't really know what it is that they're supposed to be doing. So let's think about how a clinical placement can be meaningful. So the first thing that's really important is actually a culture of learning. Is it a teaching hospital? Is it an environment that's used to having midwifery students, or is it their first time having midwifery students? What is the pedagogical atmosphere of the clinical environment? Are the staff doing continuous professional development that the students can be involved in? Or is it a private hospital where largely the staff are being educated maybe outside of the unit or something like that? What is the atmosphere in terms of learning? The leadership style of the ward manager is actually really important. And a democratic leadership style can really support that, or a compassionate leadership style as well, one where we're really understanding and bringing the students along as part of the team rather than seeing them as outsiders. It's really important that students feel like they're a valued member of the team, and that we're listening to them and their needs as well for their particular clinical learning objectives. In midwifery, we have a number of particular competencies that we need to achieve, and they're guided by the ICM essential competencies, which I'm sure Laura might touch on in her presentation. But we have our philosophy, which is really important to what we do. We have a particular midwifery philosophy. If we try to think about other professions, say medicine, nursing, physiotherapy, whatever other profession, what is it about midwifery that makes us a profession? It's our philosophy. So if we go to a unit which is obstetric-led or very medicalised, it can be very difficult for a meaningful clinical placement for midwives. So I'm going to talk a bit more about that as we progress. Cultural and organisational factors are very important. Things like bullying, which we see every day, and sadly we've had a lot of examples of that. And also the relationships between the students, the clinical staff, and the academics. So our job as academics is really important. We're that link person between the clinical staff and the student, and making sure that they're actually gaining their knowledge that they should be gaining for that particular placement. So student satisfaction. So when we're midwifery educators, I think, and even staff midwives, if you're a mentor, we have to take this role really seriously, because actually students feel really worried and anxious before especially before their first clinical placement, but I think every clinical rotation, they get really anxious and stressed. So it's up to us really to make them feel safe, to feel comfortable, and to enjoy the clinical placement and get the most out of it. But I suppose a key challenge for this is that it's actually very unpredictable. We can't tell what that environment is going to be like, no matter how much we do preparation, orientation. I'm going to be doing orientation for my second years now in a couple of weeks. I can tell them everything, I can give them their documentation, but the bottom line is those girls could go into the labour ward on the first day and walk into an emergency situation. There might be 2 full operating theatres, staff running around the place, could be short-staffed. Maybe they do want to welcome the student onto the ward, but they just don't have the time that they want to spend with the student. So this is, really, really difficult. We're very fortunate in where I am, because actually I'm going out with them. Myself and Gina have been going out in clinical placement with them to give this kind of pastoral support and to be there if they do have any challenges. But it's important to remember that the student can feel overwhelmed and that they might actually have a panic attack or have an emotional reaction that they don't expect, because birth is a beautiful thing, it's a miracle, but also maybe it's not what they expect, or there's something that they might see which might be shocking to them, or as well culturally, where we are in the UAE, if they're not married, they won't have been exposed to things like this. So even though we prepare them, we orientate them, at the end of the day, they might not really feel ready for what it is that they're about to see. And so our role is really, really important. Another challenge is that when they go into the clinical area, they might be competing with other professions like medicine for learning opportunities. So if there are medics out there, and they need to witness births or have certain skills and procedures signed off, that's very challenging as well. And something that we can do is to, obviously see and plan the placement to see what other students are going to be there, and hopefully to prioritise the midwifery students, because we have our EU directives of 40 births, 100 antenatal checks, 100 postpartum checks, 100 newborn checks, etc., that need to be completed. And sadly, we've actually seen some evidence of discrimination and racism that might be faced as well. And I think that's something that is needing to be discussed, and we need to really advocate for our students and to make sure that they feel able to speak up if they are faced in that situation. So maybe we can take this up in the discussion later. So many components influence whether the student experiences the learning environment as a positive clinical learning environment. But we do know that if they feel like it's positive, then they feel motivated, they feel involved as a valued member of the team. And if you press there, you will see a picture of our students in clinical placement at the Corniche. And they shared this on the social media, and I thought that was really nice for them to feel like they're actually part of the team. They're up there on the social media, Dr. Gina and the students. So definitely it's helping them to feel welcome. So next slide. So this is what it will look like if there is a positive pedagogical environment. The students will feel motivated, they'll feel involved, they'll feel like part of the team. They'll have really good relationships with other team members. When you go to the ward to find a student, they all know student midwife Fatima is here. She's doing a great job. And also we're able to explore and reflect on the practices. So the students really do need this preparation for the clinical learning environment, and they need to feel like they're going to be supported. They need to feel like they're free from fear, so they shouldn't feel like so nervous about working with someone, or afraid to speak up about something that they see. They need to be feeling supported, and we need to have respect for each student as an individual as well. The staff, when they see the students, should view them as younger colleagues rather than, maybe that they're in the way or a hindrance, which we hear sometimes that mentors are saying, oh, more students, but actually they're younger colleagues and they have knowledge, they're willing to learn, and they're really motivated, enthusiastic, they're delighted to be there. And when the clinical learning is environment, they develop really good positive problem solving skills and increasing their knowledge. So before our clinical placement, we didn't know what midwifery looked like in the UAE. So this is a tool that I want to share for anyone who's in other countries, maybe other Middle Eastern countries, Eastern Europe, wherever you might be. This is a tool which was developed by the WHO in Europe as a self-assessment guide, and we use this with stakeholder meetings. We went into stakeholder meetings with midwifery management, with midwives, and we asked them to complete this these questions, and it was a very nice experience to help us to understand how midwifery looked without sort of being confrontational. It's very nicely laid out and it's freely available on the internet. You can go and search that. And it just helped us to understand, mostly in the UAE, midwives are working in labour ward rather than in the antenatal area and the postpartum area. So how are we going to facilitate the learning for those students when they need to do abdominal palpations? We needed to ensure that obstetricians were on board, that they would support them to do antenatal appointments where normally perhaps it wouldn't really be a midwife. But we've been so lucky to have such brilliant collegiality from our obstetric colleagues and from all of the midwifery staff that we've encountered in all of our clinical sites. We have students now in the Corniche, in the Natal Emirates, in Sheikh Shakbat Medical City, and it's really been excellent to see the support. So I want to again, just for countries who don't have a lot of midwives or a strong midwifery practice, I want to highlight this document from the ICM. It's a policy document which defines what an enabling environment for midwives is. And it's one that supports the infrastructure, profession and system level integration needed for midwives to effectively practice within their full scope of work. This is really important because we need our midwives to graduate and to move towards licensure able to perform in their full scope of midwifery practice, even though that might not be what they're seeing. Because when we only have 10, 15, 20 midwives in a unit, they're not available to work in every area, but we need them to feel able to do that. So it's very important that actually when we're in these countries, we advocate for midwifery. So our team has been involved in the regulation of midwives here. We've been involved in writing the scope of midwifery practice. We've been sitting on national committees to progress midwifery as a profession as well, because midwifery needs to be on the agenda so that these midwives are not going to graduate working as obstetric nurses. Essentially, we need them to be leading the births, leading the care, able to do key skills like intermittent auscultation, able to do possibly pool births. They're coming in now. We're very excited about that. We need them to be exposed to many different midwifery practices that perhaps are not the routine at present. But like I said, we're very fortunate that we've been out there with the students in practice. We're able to help them to reflect. Critical reflection, which is a key aspect of what we do. If you're going out there and practicing, you have to be a reflective practitioner. Without reflection, the placement is meaningless. You have to think about what you're seeing, apply it and compare it to what you're seeing and thinking about the situation and how did you feel about it, evaluating the care that you gave and how would you improve going forward. And we're lifelong learners. You will never be perfect. You could be 15, 20, 40 years qualified, I'm sure, and you will always think of ways that you could have improved the situation. And, I met a student this morning and she said to me, Miss, I apply this in all my lifelong situations now. I have a situation that occurs and I try to reflect. Something happens in my family life or in my home and I think about it in a reflective way. So you can use very simple reflective model like what, so what, now what, or you can use Gibbs reflective cycle model, whatever it is that can help you to reflect about a situation. And like I said, when you have especially emotional challenges, maybe you're faced with a neonatal resuscitation by surprise or postpartum hemorrhage, whatever emergency it might be, maybe you're taken by surprise by how you reacted that moment. You think that you're going to be able to follow that protocol, but actually there's a block somehow. You need to work that through and think about, well, what am I going to do next time? What strategy do I have? Can I take a big breath in and count to 3. What am I going to do that is going to help me to perform? Because at the end of the day, you have to be able to perform. So I would urge all of our listeners tonight to, if you haven't done a critical reflection in a while, do one, because it's also part of our revalidation for the NMC. So in conclusion, I will say that we really need to be proud of our role as midwifery educators, and we need to be very supportive of our midwifery students in clinical placement. It's a unique experience for them. I think it can become a part of our routine, what we do. But our pastoral care role is really, really important. And for students, or for countries that are starting out on their journey and developing degree programs, reach out to me and Gina. We've just gone through this process. If you're wanting to speak to us about what we did, we're very open. But I will say that your stakeholder meetings, getting everyone on board with your plans for the program, but making sure that your clinical placement have meaningful learning objectives, that you're actually being exposed to full scope midwifery practice is really important, and using your critical reflection as well to help the students to make sense of their clinical experiences and their situations. So I hope that's been useful. Thank you very much. You can go to my last slide. If you want to contact me, my email address is there, and follow me on social. But I'm looking forward to our discussion.